No, your speaker. Good morning, everyone. We're just turning our sound off here so we don't have some echoes. So thank you for joining us. And we're going to get going with Glenn's presentation this morning. So I hope you enjoy it. Just give me a second while I share my screen. Make sure.
Hello, everyone. My name is Glenn Robitaille, and I'm very happy to be participating in this Mental Health in Motion event and to be able to talk to you about the subject of choosing to heal, particularly focusing on helpful strategies for self-care following a loss by suicide. So I'm the Director of Ethics and Spiritual Care here at Waypoint. I am also the Director of the Ontario Structured Psychotherapy Program for the North Simcoe Muskoka region and a registered psychotherapist. And I've been in the field of mental health on and off for the last 40 years. So it's my pleasure to be able to talk to you about this very important subject, which has really been elevated during this pandemic, not only for those people who've experienced a loss by suicide, but anyone who's experienced the loss of someone by sudden death. So I'm going to be sharing my slides. So you'll be seeing me a little bit more small throughout this event. Hopefully that won't be too distracting for you. So let me begin by saying that I have had experience with this among my own relatives and my extended family. So there's some personal investment in the subject of dealing with a loss by suicide. I've also been able to support the Suicide Awareness Week for the last 6 years on behalf of Waypoint with community events. It's been an important part of my mental health care provision for the better part of 2 decades. I've also been able to support people and families through suicide as part of my work with patients and with clients. So I just want to put it in context that the things that I'm going to be sharing, while not exhaustive, they're not theoretical. They are, for me, very important things that have helped me with my own role in supporting people through a time of loss. Let me begin just by saying that suicide is a huge issue in our country, as it is in most countries. It seems to be increasing. There are a number of demographics that you probably have been hearing talked about in the news. One that's been on the news recently is the idea that many more women attempt suicide, but more men actually accomplish a death by suicide, usually because the means they choose are more violent and therefore more effective. If you are going to work in this field, if you're going to be supporting someone who is depressed, there's a high likelihood that at some point in time you're going to experience a loss through suicide. So that's what we know about suicide. These are the stats. So to pull these off the Government of Canada website, most recent ones being from 2016, but they are pretty reflective of what I hear. It's pretty much a bell curve for both men and women, where men are the blue lines and women are the red. But you can see that there's risk at every age. Seems to be the highest risk for both sexes is during that period between 40 and 59. And then for men, there's this also pretty loud graphic when they're 80 plus. And notice the disparity between women in the 80 plus age group and men in that age group. And we've long known anecdotally that men do not do as well when they're widowed and are on their own, seems women have more resilience to be able to handle those things. So that's maybe there's a lot that we could unpack around these statistics, but as you can see, it's a very prominent and important discussion in our country. So when we talk about our reactions to a suicide, I want to amplify 3 principles. I'm going to do them each one by one. The first one is that emotions are not chosen, they are what they are. Secondly, I want to talk about how suicide is a valid option to those who are suffering. That's not something we're always comfortable with, but something we do have to recognize. And then thirdly, when a suicide occurs, it is not necessarily a failure on anyone's part. So when I say emotions are not chosen, they are what they are, I'm just acknowledging that people do not choose their emotions. They just kind of occur in the moment. They're based on our perception of an event, not necessarily the facts of the event. So therefore, you should feel no guilt whatsoever for any feelings that you have. Feelings cannot be wrong. They're neutral. So sometimes people will feel guilt or shame or anger. Sometimes people are numb following the knowledge of someone having taken their life. Others will, at a certain point, feel a sense of relief. And if you think about it, if a person has been waiting for that call for a long period of time and has always anticipated that it was possible, and so living on pins and needles, it's very common that people might express a feeling of relief when they know that isn't going to happen anymore. It's they don't have to sit there wondering or worrying because it's over with from that standpoint. And often people feel guilty for feeling that sense of relief. Well, again, emotions aren't chosen, they are what they are. If you feel relief, well, it's because in some sense you have the relief of not having to worry constantly about the possibility. I also want to say feelings are not facts, they're perceptions. I've already mentioned that. And when we're connecting to a person and the loss that we've experienced, we're doing that from our own axis. So we've got our own investment in the relationship, our own losses, our own preferences, all of those things. And that may be quite different from the axis of the one that we lost. So we have one experience of what's happening, they have another experience of what's happening. And so therefore we just have to acknowledge that. And it's not possible for us to know the depth of another person's despair. Also want to say around this subject of emotion that there's no such thing as a normal emotion. And people often ask me that, tell me what they're feeling, and they'll be worried, is this normal? Well, there are no normal emotions when you encounter a death by suicide or any sudden loss for that matter. And there aren't any that are not normal. They're all on the table because they're based on perception. So some may be completely overwhelmed by the loss and experiencing it very emotionally. Other people could numb out and find it difficult to even connect with it. Their mind just can't take it in. Those are normal responses that people can have, and probably some that I've not mentioned. Secondly, and as I said, this is the one sometimes people struggle with, suicide is a valid option for the one that's suffering. So we know that suicide or suicidal thinking is a symptom of depression. So if a person is experiencing a deep enough depression, they're probably going to have some ideation around suicide. It has been said and proven recently in a study done in Australia that having suicidal ideation is no greater predictor of suicide than not having suicidal ideation. In fact, being male is a greater predictor of death by suicide than actually having suicidal thoughts. So we have to recognize that for the person who's being depressed, that may be a valid option for them, and often as a protective factor. So if I am suffering and I can recognize that if it gets bad enough, I always have this option on the table, then knowing that this is a card that I can play if things become bad enough does often protect people from actually taking their lives. So I try to recognize that when I'm working with individuals who are supporting people who are expressing suicidal ideation, that you can't ignore the fact that the person is the one having the experience, and for them, acknowledging the possibility can be a protective factor, preventing them from actually making that step. Also, you can accept the fact that it is a personal choice without ever having to agree with it. So you're not morally agreeing, you're not supporting a person's decision should they do it, but you can accept that you really have no control over it. It's in the hands of the person who actually has to decide what's going on in their life. Because only the sufferer, only the person who's struggling with whatever it is, can fully appreciate what's going on in their own life. And often when we're the ones that are supporting someone who's having suicidal ideation, we're thinking that it's life at all cost. That's how we're thinking. It really doesn't matter. Our greatest goal is keeping them alive. That's fine. But for those who are suffering, they're thinking about it differently. It's hope at all cost. It has been said that there are many, many reasons why people actually decide to end their lives, but there's really only one cause, and that is loss of hope. When there's no longer light at the end of the tunnel, that's when people are most vulnerable to making the active choice to end their lives. And finally, and this is really important, you can embrace the possibility of this happening without approving of it. Our goal, if we're supporting someone who's expressing suicidal ideation, is actually to walk with them through it, to be a support for them. In mental health first aid, people will often ask the question about whether or not you should ask someone who's depressed whether they're having suicidal thoughts, because you might put it into their heads by saying it. And no, you can't do that. It's always best to ask. There's often a sense of relief from the person who is asked about whether or not they're having suicidal thinking that you have asked, because then it gives them permission to actually talk about it. And that's very helpful, to be in a safe place where you can actually talk truthfully and honestly about your feelings. Because if we're not open to their pain, if they don't feel that we're going to walk with them, maybe that we will walk over them, then we're not going to be allowed entry into it. And being able to get in there and walk with people is probably our best opportunity to have some influence, if we can have influence. And let me tell you, in my experience, you can't always have influence, no matter how well trained you are or how much you know. That being said, then, I think we need to recognize that a death by suicide is not a failure on our part. Just because someone makes the decision to take their lives doesn't mean you've done something wrong. Everybody worries about that. I should have done this. What if I had done that? Maybe I missed this. Those are very common. And so if you're feeling thoughts like that, or if you've had thoughts like that, you're right in there in a normal reaction that people have. But I need to say that some problems can't be solved by loving profoundly. It's not about how much you love a person, but we can recognize that loving profoundly is a value unto itself. So whether or not my love for a person actually does give them hope that allows them to maintain until they can actually get the kind of help that they need, whether it does that or not, a person feeling that they are truly seen and accepted by me, if I'm working with them or supporting them through an experience like this, is a value all unto itself. So just value the love that you're giving. That's the part you can control. Whether or not it has impact, really, you have no control over that at all. Because if not feeling loved isn't the problem, for some people that may be the problem. There's probably a small percentage where the reason they despair of life is because they had an event in their life that made them feel abandoned or unloved. So I'm not saying that never happens. But if not feeling loved isn't the problem, then loving more deeply is never going to be the solution. There's this thing that happens when people have suicidal ideation that approaches almost psychosis. That when you get to a certain place in your thinking, it's hard for you to see reality any differently than how your emotions are presenting it. And so what AA would call stinking thinking. When you get down at the bottom, you're thinking so poorly that you can't make right choices any longer. Stinking thinking is a more powerful influence for your loved one than your love for the person or theirs for you. So again, it's not necessarily because we've done something wrong or that we failed them. They just have a very painful reality, and this is how they're thinking about it. So if someone you know or someone you love actually dies by suicide, if we are truly loving, we're not going to judge the sufferer. We're not going to judge that person. We are able to accept the choice, knowing that it's not my choice, it's not my life, it wasn't my suffering. We are able to accept their choice without necessarily agreeing that it was the right thing for them to do, and just embrace that which we can control and control those things. So with that kind of as background, there are a number of ways that people feel the blow of a loss. And I mentioned this briefly earlier, the idea that people can become triggered and deeply emotional, have strong emotional reactions. I would say that there's very few things in life that are more difficult to process in the moment than knowledge that someone has just died by suicide or a sudden loss of any kind that takes you by surprise. And some people will become very deeply emotional, and other people become numb and emotional. And there's this whole range in between that where people feel a variety of things in between those two poles. A lot of things factor into that, what our personality is. In certain cultures, it's almost expected that there will be wailing, and that's seen to be a part of the response to a death. The depth of relationship we had with someone is going to have an impact on this. So your reaction to a death is your reaction. And so you're not choosing your feelings and you're not choosing your reaction. But once that reaction has had a chance to settle, what you do next is what matters. And that's what you have some control over. Usually, when a death by suicide has occurred, it really has very little to do about grief or bereavement. That's something that happens later down the road. The early experience of loss by suicide or any sudden death is more about trauma. And so I just want to talk a bit about what trauma does and what trauma is like, both for allowing people to identify and recognize that they've experienced trauma through this, and perhaps to recognize that if you're supporting someone who has had a loss in their life, and so you want to recognize the signs and symptoms. So when trauma occurs, there's usually emotional flooding, where there's a release of adrenaline and cortisol. So with that, there comes symptoms, and one of those is the reaction that we have, which could be a fight or flight reaction, or sometimes a freeze. So that would be the numbing out piece. So that gets activated at a time like this. When I go in following a trauma to provide trauma support here at Waypoint, we will look and we will identify in the group that has had the experience those that are highly emotional, but we're also looking for the deer in the headlights who are basically experiencing the freeze aspect of that. And although what triggers us differs, everyone under certain circumstances is going to experience flooding. And more often than not, when flooding occurs, it's the body's natural defense to provide us with the energy to act. So when the fight, flight response or freeze, you see all of those in nature, was a highly functional thing. It was at a time when there was great risks in the environment, and usually having that response was going to protect your life. Now it happens for reasons other than the protection of life, leading to other kinds of disorders. But it activates just as often when there's a perceived threat as there would be when there's an actual danger. But it also occurs, and more to the point of what we're talking about now, when a shocking reality occurs that overwhelms our ability to emotionally process that event. So when flooding occurs, there are physical symptoms. There's an increased heart rate. People can't hear as well. Their auditory processing is compromised. So if you're talking with them, they're probably not hearing you anyway. There may be, and often is, what they call hyperhidrosis, where the areas of the body that are prone to sweat, armpits, hands, the brow, places like that will happen. A dry mouth, tightening of the muscles in the neck and the jaw. You probably would recognize these things as happening when you're experiencing nervousness on the whole. It gets amplified during a time when flooding is occurring. Then there are mental symptoms. People have difficulty concentrating or comprehending, and so they're confused. Because of that, they are not able to solve problems. If someone needs help in that moment of very simple things like getting home, it's better to offer those things than to ask them to make the choice. They aren't able to clearly communicate their thoughts, give them time and distance with that. But if a person's experiencing mental confusion and difficulties, I mean, that's very normal. That's part of what happens when a person is traumatized and they're having emotional flooding occur. When we see others, you may notice it by recognizing pressure to disjointed speech. Often there'll be a change in color in their face. They'll become more flushed, or their eyes may be more wide, their movements more agitated. Again, because of the cognitive processing piece, they may be more unresponsive to feedback. And again, they may be very emotionally dysregulated. All of those things are things you can note as possible evidence that a person is being traumatized in the moment. Later on, it's quite common for those who've had a loss to have to struggle with situational depression. So depression, again, affects people differently. But when people are depressed, they experience a combination of symptoms that could include prolonged sadness or feelings of emptiness. You know, when there's a loss, it leaves a vacuum. And so they'll feel that vacuum. They'll feel emptiness in their life with the loss of that thing. Maybe helplessness or hopelessness. Again, we've talked about how guilt, worthlessness, which connects more with shame. They could be more angry, more irritable. Restlessness comes with depression. So all of those things are possible, along with fatigue, changes in sleep patterns. Sometimes people have a difficulty waking up and they just want to sleep all the time. If there's an anxiety factor involved in it, often people experience what they call terminal insomnia, which means they'll get to sleep, but because they're having anxiety, it'll wake them up and then they'll have difficulty getting back to sleep. It's normal for appetite changes to occur, either people needing to eat more or people being unable to eat. One of the things that often happens, I'll mention this in a minute when I'm talking about the somatic piece, but I'll mention it here as well, that the sphincters of the body are affected by trauma. So often people feel nausea, or they have an increased urge to use the bathroom. And so that could lead to stomach aches, but it usually attacks the most vulnerable system in our body. So if you're given to experiencing headaches, you'll probably experience that. You have more gastrointestinal stuff, you'll probably be experiencing disruption there. Of course, the withdrawal from friends and family, it would not be abnormal when a person has had a suicide occur in their close relationships to actually have thoughts themselves. Again, having thoughts does not mean that the person wants to die by suicide. It is evidence that probably some depression is emerging. So when we're depressed, it affects our emotions, thinking, behavior, and our physical well-being. So I've covered some of these things already, but our emotions around sadness, anxiety, guilt, anger, there's really nothing off the table. Our thinking, we could go to self-criticism. Again, what did we miss? Pessimism about the future. Again, impaired decision-making and impaired concentration. You may see all the behaviors that would go in with a range between crying and withdrawal, not being able to take care of basic needs, lack of motivation. All of those things are possible. Then physically, chronic fatigue, sleep changes, either greater or less needed, and changes in our eating habits, sexual impairment, aches and pains. This is a slide that I borrowed from the mental health first aid module that I do, just to express how some of the impacts of depression actually are. So how can we manage some of those emotions? Well, first of all, identify your physical symptoms. This is what you call, identifying the microscopic truth, not the meaning of what you're feeling, but the source of what you're feeling. So You dive into your body and you pay attention and try to find your physical reactions. For instance, if you're clenching your fists or your jaw, then you would want to do things that would help to relax those areas. You be conscious of it, and you do techniques to relax those muscles. If you're experiencing shallow breathing, which is common with anxiety, then you want to do a breathing exercise to help stabilize your blood gases. So when people are breathing shallow, it's concentrating carbon dioxide, which increases anxiety. So you want to do a breathing exercise to help stabilize those blood gases. You want to pay attention to your emotions, observe them, and know what they are. Again, take a few deep breaths through your nose and exhale through your mouth. That can be done anywhere at any time just to help stabilize the blood gases. When I talk about choosing to calm the mind, Martin Luther, who was a Lutheran theologian, probably he was the founder of the Lutheran Church, made a comment that I thought was quite worth repeating. He said, "You can't stop the birds from flying over your head, but you can stop them from making a nest in your hair." So if you don't want something to take root in your life and cause more problem, the first thing you have to do is observe that those thoughts are there. So observe the birds and then choose to not let them make a nest in your hair. Focusing on one thing is a mindfulness technique where you draw your attention to one thing. When I was in private practice, I used to keep a tennis ball on my desk, and if someone was being anxious, I would throw them the tennis ball and have them focus on it and feel the weight and the texture and the give. And it's a way of just helping them to distract from the moment and focus in. Soles of the feet is a technique that comes from dialectical behavior therapy, where you have the person focus on the feeling of their feet within their shoes and the ground underneath them and the warmth. And again, it's the same principle as the tennis ball. It's just causing you to focus in because the way to overcome anxiety in the moment is to control that which you can control. All anxiety stems from a sense of loss of control. So identifying what we can control and doing something with it is often very helpful. So to support resilience, I have a few strategies I'd like to offer. And again, this isn't an exhaustive list. These are just some that I have found helpful and useful. Beginning with the step back, which those of you who know me know that this is a staple of mine when it comes to dealing with crisis of any kind. Instead of going headlong into your emotion, when you start to recognize that your emotions are taking over, the first thing you want to do is take a step back from it and nip it in the bud. And in this case, if you're starting to personalize the loss, you want to step back and you want to nip that in the bud and say, just because I feel it doesn't make it so. What's the truth? And then another thing is to dignify your pain and recognize, as I said, your feelings aren't chosen. They are what they are. So don't be hard on yourself for them. Don't punish yourself for it. Just acknowledge them and recognize that they are there because for some reason they have a right to be in your life right now. And so acknowledge them and observe them. Focus on healthy self-talk. Often when we're having negative emotions, in the back of our mind, we become very self-critical. Often we'll know that because of the things that we're saying out loud about ourselves to others. So rather than focusing on our feelings at such times, we have to focus on controllable actions and things that will help us to focus on the things that we can do to feel better. One thing we can do is talk it through with a listener that is a good, healthy listener, which means they're not telling us what to do, they're just listening. Or for those who don't necessarily like to do that, you can journal. If you're really finding it difficult, you can seek out a group or one-to-one counseling. It's important that we avoid procrastination and do unpleasant necessities very quickly. The more things that pile up, the more difficult it becomes for us to feel as though we're in control. So try to put the things that need to be done on the front burner and get them done quickly, and that will help to help one to feel that they've maintained a sense of control. Make sure you're also keeping current with others. There is a tendency when we're feeling um, difficult feelings to self-isolate, we need to be reaching out to the people who are important in our lives. Also maintain an outward focus. The temptation again is to be self-critical, to go in, start self-examining, asking what we could have done differently and all of that. Instead, keep an outward focus and affirm the things that you're doing, affirm your disciplines in order to stay well. I can't underestimate the importance of movement, exercise. It is really important during times when we're feeling lethargic and we're feeling as though we have no energy. The antidote to having no energy isn't always sleeping. Sometimes it's getting out and moving, getting our blood pumping. So make sure we're doing that and eating healthily and balancing that with a good amount of sleep, and moderating our intake of things that are substances that alter us, whether they be stimulants like caffeine or depressants like alcohol. Those things can provide short-term relief, but they often can create longer-term difficulties. So there are some protective factors for us, and the most significant predictor of mental health and well-being is resilience. And there are things we can do to increase our resilience. So I mentioned at the beginning that the point of my presentation today is to talk about choosing to heal. So people often think, as a starting point, if I stop hurting, I'm saying that the loss no longer matters. I have seen this many times, that people equate the amount of suffering that they're experiencing with the depth of the loss. And so they will hang on to the pain as the connection between them and the person who's lost, feeling that when I say, when I stop hurting, that I'm saying that this loss no longer matters. Well, that's not true. The reason that happens is because pain can, in a very subtle way, become our connection to our loved one. And we don't really want to lose that connection. So if that's the final cord we have between us and them, people often hang on to pain far too long. And I think that's a temptation for everyone at some level, to feel guilty if I suddenly start feeling better. And so we'll actually sabotage ourselves from feeling better. This doesn't happen immediately, and I don't generally give people the advice or the feedback to start connecting their connection to their loved one with their positive memories early on. I will wait a while until people have had a chance to really dive into the loss and appreciate it for what it is. But when the time is right, that's what has to happen. The connection to our loved one has to shift from the pain of the loss to the positive memories that we have with the person, things that will help us to remember positively the gift that the person was in our lives. And, if we really stopped and thought about it, the last thing that a person that we've lost to suicide would want is for us to be experiencing pain at every thought of them. They would want us to be able to do exactly what I was describing, to be able to connect with the positive memories and have some joy in the remembrance of our loved ones. So again, when the time is right, that's what we want to do, is we want to start moving to those places. And I've often recommended people keep a journal and actually write down memories, those positive memories. So rather than having to go searching for them when they're kind of triggered to remember their loved one in a negative way, they can just quickly reference some of the things and kind of shift their focus. I also want to say that anyone who's gone through a loss like this knows that the pain never really goes away. It does soften, and over time it can become integrated into the fabric of our lives and produce its own gift. That doesn't mean that again that we now say that the loss is a good thing. No one really ever gets to that place, but there are times that we can grow from these losses and integrate them into our lives in a way that allows us to become more human, maybe work more closely with with people who are suffering and have a better understanding of what they might be going through. Henry Nouwen called that the wounded healer. Many people working in the field of mental health would identify with that because, those who have suffered actually have the ability to experience empathy more easily because they have some personal knowledge of it. In ancient and traditional cultures, when they talked about the medicine man, one of the ways that they would identify the person who was the medicine man was the fact that they had experienced suffering and had gone further down the road, and so therefore they could help others to walk that road because they knew more about it than those who had not walked it at all. So that is one of the benefits that we can embrace in our life, recognizing that it really doesn't matter if you're 25 years away from the event or 30. There's always going to be that place in your life where it's going to produce some pain, but it can be integrated into in a more helpful way. So here are some follow-up approaches that we can use to reducing anxiety. I've talked about the relaxation techniques of deep breathing, meditation, and mindfulness. The idea of focusing on what we can control, that's absolutely fundamental because anxiety flourishes on loss of control. So focusing on what you can control is a remedy for that in the moment. Avoid thinking too far out and focus on the present moment. We'll be tempted to not involve ourselves in meaningful activities, but if we engage in activities that have been meaningful to us in the past, that can be helpful to us in the present moment. And to reinforce all those disciplines of self-care that we've talked about, healthy diet, regular sleep routines, exercise. And I usually recommend that people schedule time for fussing, because if you don't, you'll be fussing all day long. So not everybody can do this. It works very well for me. If there's something that I'm fussing about and I know that I am, I'll schedule some time to actually focus on it and instead of let it be this nagging voice in the back of my head interrupting my ability to be present in the moment. I would ask you, if you're interested in more information on any of this, to look up the workshop I did earlier this spring called Coping with Loss in Times of Crisis. I cover things in that workshop that I'm not talking about here, but are also very relevant. You can find it on YouTube. You can also find it on Waypoint's YouTube site. So I would invite you to view that if you'd like a little more information. So I would like to thank you for giving me this opportunity to share a few thoughts from my experience and from my life. Hopefully some of this would be helpful to you. I am leaving my contact information for you. If anyone would like more information, would like to ask me a specific question, my extension here at Waypoint and my email address are on the screen. Please feel free to reach out. So thank you for participating in Mental Health in Action. I hope that you enjoy the rest of the week and the presentations that will be given.
Okay, well, thank you very much, everybody, for tuning in. I hope you enjoyed Glenn's presentation. I know I did. And be sure to join us again today at noon for Dr. Rob Meter. Have a great day. Take care.